They left their homes in search of opportunity in Iran. Instead, witnesses say they were killed, their final moments terrifying.
The Iranian border guards first beat us, then made us do hard work. Then they took us by minibus near the river, and when we got there, they threw us into the river.
Dozens of Afghan migrants are said to have drowned in the river that flows between Iran and Afghanistan. Their distraught relatives and the Afghan government want answers.
My brothers went to Iran 3 days ago. Yesterday we heard that they were drowned. The Iranians took them to the river and threw them into the water.
The Iranian consulate in Herat has denied the allegations. The incident could trigger a diplomatic crisis between Iran and Afghanistan at a time when the coronavirus pandemic has seen an exodus of Afghan migrants leaving Iran and returning home. At least 265,000 Afghans have crossed back from Iran this year. Some blame them for bringing in the virus. Iran has the region's worst outbreak, but despite this, some Afghans continue to look for a better life there, trying to escape conflict and poverty. Decades of war have left Afghanistan's health system woefully unprepared for a major outbreak of the virus. There are about 3,000 confirmed cases here, but it's feared the virus is spreading fast after random testing in Kabul suggested a third of the people in the capital could be infected. Efforts by the government to persuade people to maintain social distance haven't been entirely successful, partly blamed on low rates of literacy in a densely packed city. Activists warn of a horrific human tragedy in Afghanistan if the virus becomes widespread. For some, trying to escape the country's problems has proven just as deadly. Alexia O'Brien, Al Jazeera.
Well, let's talk about the incidence of those coronavirus cases in Afghanistan. We can speak to Habib Wardak, who's a political analyst, joins us on Skype from Kabul. Welcome to the programme, sir. So if a third of residents are indeed infected in the capital, Kabul, this is a very, very serious situation.
Indeed, yes, it's a very serious situation. Kabul and a few other cities such as Herat and Mazar have been quarantined. People have been asked to stay home for the past almost 2 months now. But you still see regular activities. You see a lot of traffic on the road. Where I'm having my Skype call right now is I live in an apartment which is just adjacent to a main road, and you could hear the cars moving around. The government is saying that nobody is allowed except these various government agencies that includes officials from the Ministry of Public Health, but you don't see the enforcement. You don't see the government, the police force asking people to stay home. You see people still traveling between provinces via road, people coming and going. We have had a sample test done by the Ministry of Public Health, and it showed that almost half of the people were tested positive with COVID-19. Yes, it's still 2,700 people that have been tested positive, but my assumption and firm conviction is that we have way more than that people who are suffering with COVID-19. People are not going to voluntarily give their test for testing because they don't trust the government infrastructure. There's not much the government can do.
Right, and if we're looking at tens of thousands of infections there in Kabul, what is the infrastructure like? What is the capability of the hospitals to cope? What kind of medical facilities are there, and indeed protective equipment and so forth?
There was a private hospital about a few weeks ago which got shut because all of its medical staff got infected with COVID-19. You have two hospitals in Kabul. One is that does its testing, and the other one is that is responsible for the quarantining and basically admitting patients. That has its own problems. You will have its doctors coming on social media and basically shedding tears because they don't have the facilities, they don't have the support. And you will have people complaining on social media for saying that it has been 2 weeks that they have given their tests and the results have not yet come out. The 2,700 number that we have today is because not we have the limited number of kits available for testing, and on the other side, the pace is just slow. You give in your test today and it might take about 2 weeks so that they could announce the results of whether you were positive or negative. And sometimes that doesn't even happen. They lose the track. It's a government bureaucracy, it's a government infrastructure, it's slow, it's incompetent, but that's what we have, I mean.
OK, Habib, let me just jump in there. I just wanted to ask, this is the situation in the capital where there is testing, albeit very, very limited. What about the vast rural areas and mountainous areas of Afghanistan where people live, where there's no testing and almost no medical facilities at all?
So just before we actually talk about rural Afghanistan, a little bit background that we can give about rural Afghanistan. The COVID-19 that came to Afghanistan largely came from our neighbor Iran. And it came via these laborers who goes to Iran and work as illegal laborers. So it was brought to Afghanistan via Iran, largely speaking. And these majority of these laborers or these people who happens to live and dwell in rural Afghanistan. So my assumption is that it could be far worse in rural Afghanistan than what you have in Kabul. The only advantage that you have in rural Afghanistan is the scattered population and lack of consistent interaction among people compared to what you have in Kabul. But yet again, what you have in rural Afghanistan is, access to health, access to doctors. You will have perhaps one sort of hospital per each province. That is the central provincial hospital. That access to that becomes extremely difficult because of security, areas controlled by the Taliban vis-a-vis areas controlled by the government. It becomes an extremely difficult situation. We are talking about bending the curve. My assumption is that the world might be able to bend the curve. But when we look at the realities on the ground in the Afghan situation, we are way behind, and it's going to be a far deadlier disaster in the Afghan situation if not cooked up properly.
Well, Habib Wardak, it's great to have your perspective on this. We do appreciate that. That's Habib Wardak there on these worrying figures of growing COVID numbers there in Afghanistan. Thank you, sir.